Okay, good. Before we switch over, because I do want to talk about the flight nursing, just because I feel like that's like the apex of ER nursing, because that sounds just insane, and I want to go there. But before we leave the like actual ER unit, right, the floor, just talking about working in an ER, I can feel myself burning out, right?
Yeah.
So it seems like the speed at which everything's happening, the chaos at which like just the whole place is. I feel like there would be a higher percentage. I don't know the numbers. I haven't done any research. Obviously, this is just what I'm thinking about. But is the turnover much higher in ERs? Do you guys deal with what's it called? Burnout. How are you keeping your mental sanity with all of that going on? And what do you guys do as a team, as a unit, as just nurses to alleviate that kind of stress?
Yeah, that's a great question. I would venture to guess as well that burnout it is a high turnover in the ER. Burnout is definitely a significant issue in the ER. We see, I like to call it the good, the bad, and the ugly. You know, we see miracles, we see really, really bad stuff, and we see some really ugly stuff. And you know, you've seen it on the floor as well, what that ugly is. And those are the kind of things that will burn you out. And those are the kind of things that you have to watch for. So one of the things that we do in the ER, when I was sitting in on interviews as the educator, we would interview new hires. And one of the questions we would always ask is, what do you like to do outside of nursing? And so people would say, I like to play a musical instrument, or I like to go to church, or I like to walk my dog, or I do yoga, or whatever, fill in the blank. And it looks like a little benign, like getting to know you question, but what we're really asking is, do you have a therapeutic coping mechanism that you can turn to when this job gets really, really ugly or really, really bad? We need to know that you have something established in your life that you can turn to when you're having one of those shifts that's bad. We turn to one another for sure. We do a lot of informal debriefing at the Mexican restaurant after shift, like legit and for real, that happens. And I think each individual practitioner has to figure out how to do it on their own.
Of course.
One of my hacks is I like to make connections with patients. It's one of the things that I feel like we miss out on in the ER, that you guys, when you see the same patient and the same family 3 or 4 shifts in a row, or sometimes even weeks, you're off and you come back and they're still there, you know, and you've developed this rapport with them and this love for them. And, you know, we have to figure out how to do that quickly, really, really quickly. And we don't get that depth of relationship that you do. But sometimes a little lonely nursing home patient that's hanging out in a hall bed that, you know, needed a G-tube replacement, or, you know, syncopized, but we can't really find out anything. You know, they're okay. We tuned them up a little bit. They're getting ready to go back. And you just take a minute to connect with them, or you just take a minute to chat them up, and then they think you're the greatest thing ever because you spent a little bit of time with them. You know, kids will do that for me too. Pediatrics will do that for me. The other thing that refreshes me is preceptees, nursing students, people who are jazzed and excited and on fire again to do the thing that I love. It reminds me, oh yeah, that's what it's like. That's how great it is. You know, I'm only in the ER now, a PRN, so it's much easier for me to take a lot of the crap than the people who have to do it, you know, 312s or more a week. So yeah, that's definitely a real thing that we definitely have to figure out and work on for sure. There's a couple of nurses, in fact, that I want to interview myself because they have been in the department for forever, and they must have some kind of secret sauce because right. They're not crusty, they're not jaded, they are still kind, and they still love the department. And I want to know what their secret sauce is. I know what I can do for me. But there's some folks out there that have some longevity, and they must know something. A lot of new grads will come and go by the 3rd year. I don't know if that's different than ICUs or med-surg, but if we can get 3 to 5 years out of them, we're pretty happy.
Wow.
And then here's the other thing about that is, you know, let's say you get burned out at year 3 and you decide to step away and go do something else, you know, whatever that thing is. you can't undo the things that you saw in those 3 years. Those things still happen to you. You still witnessed them. They were still really ugly. And that's an important thing to point out. You can step away from the profession or step away from the department and not see any of those new things, but you still have those patients that kind of touched you or that you will always remember because of how bad it was. Those things don't just disappear when you go to a different department. So you have to have a way of dealing with it and reframing it or compartmentalizing it or tucking it away in your heart or whatever it is.
Wow. I mean, it's heavy. It's heavy. And I can see exactly what you meant because like, you're right. There is no answer to those kind of questions, right? Like you don't have an answer. Like, what are you supposed to say, right? Like, how do you stop someone from becoming jaded? How do you build that empathy up again? We don't have those answers. And I can see your frustration or your, just you're wary when you talk about certain aspects of nursing like that. So I really appreciate you at least, giving me what you could give me.
And I will say for me, and you can tell me how it is in your nursing practice, and I'm not sure if this is how everyone feels, but for me, that burnout or that love versus maybe I don't want to do this anymore, it's not linear for me. It doesn't go like this.
Oh, yeah.
It's like this. It's peaks and valleys. Like I love my gig. And then 6 months later, I'm like, oh my gosh, this flu pneumonia season, we're getting hammered with all these sick people and maybe I don't want to do this. It kind of is a roller coaster. It's not just like this or like this.
Yes. No, respect. And no, you're right. You're right. And yeah, that's exactly how it is. Like some days, some weeks, and some months, you're like, I'm a nurse. I work 3 days a week. I got 4 days off. I'm living the goddamn dream. And then other times you're like, I'm done. I'm goddamn it. I'm done. Right. So yes, no. So I hear you.